Hello, everyone. My name is Gabby Boyd. I'm a Latin American correspondent for Latina Republic. We are a nonprofit news organization that is dedicated to amplifying the voices of Latin America. And today I'm here with Claire and David Charnock, the co-founders of the Medical Tourism Directory of Costa Rica. If you two would like to introduce yourselves and kind of talk a little bit more about your work before we begin, that would be fantastic.
That's lovely. Thank you very much. Yes, Claire and David Charnock. We are from Northern Ireland and from the United Kingdom. And we've lived in Costa Rica for about 15 years. We first started thinking about our business around about 10 years ago.
10 years ago we started, yep.
Yeah. So we developed the idea. It was mainly Claire's baby. And we sort of started from very small and now have a very nice niche directory that we share with lots of North American, Canadians, European people to bring them to Costa Rica for their medical treatments.
Well, amazing. Thank you for sharing that. Claire, if you'd like to say anything as well.
Yeah, certainly. So we started to look at medical tourism because we knew it was a booming area here in Costa Rica. So we went online as users to try and find great information, and we stumbled a lot in terms of, sometimes people are too busy to respond or didn't respond in good English. So we could see that at that stage 10 years ago, there was a big gap in the market to be able to help people from overseas, but also within the country. We have a lot of expats living here as well. So it just started off with the web domain, Medical Tourism Costa Rica. We visited what we considered to be the best providers at that time with a very makeshift website. And then from then, I think we're on to our fourth website, going for our fifth now. It's really well optimized on Google US. So we do get a steady flow of inquiries. And we've taken it from there. We had to sort of change a little bit because not everybody wants that medical tourism label. So we have also domains with health travel, because we love to focus as well on the preventative side, the wellness side as well, the wellness, the yoga retreats, all those great things that Costa Rica is also very famous for.
And I think one of the things that's worth adding that Claire has managed to achieve with working very closely with a search engine optimization agency is that within 3 years of launching the business, we were on the first page of US Google for medical tourism. So we actually managed to get ourselves well recognized and well optimized within a very short period of time.
Well, excellent. Thank you guys for sharing that information about your organization. Sounds very, very helpful, especially for those who are not aware of the medical tourism business in Costa Rica. So for the typical types of services that are provided in Costa Rica, is there any that you would suggest being like the most popular or the most frequented by your users?
Okay, so a lot of our clients, patients, friends come from the United States and from Canada. Okay, so obviously Costa Rica is nice and close. There's lots of direct flights. The reason for them coming usually will be because of long wait lines, which happens a lot in Canada as it does in the UK, but long wait lines. Or in the States, it's just simply a matter of pricing, and maybe people don't have insurance cover or sufficient insurance cover, and they want to pay out of pocket to come privately here in Costa Rica. So the main things that we have clients for would be obviously dentistry. And people will, come and then come back 3 or 4 months later as well. Orthopedics. So rather than stay in a long wait line in Canada, they want to come over and pay here. Weight loss surgeries, obviously cosmetic surgeries as well. Although we are seeing more and more of people who want to do non-invasive procedures rather than the cosmetic now. That's becoming more LMO. And then the wellness and the yoga retreat style opportunities as well. So across the board. And if somebody asks for something we don't have, we find it.
Excellent. That's very interesting. I mean, you would never think about like traveling to a different place to, get a service, but I mean, Costa Rica sounds like it's, top of the top of the board, I guess I should say. So, with
Yeah.
that, what do you think is like unique about traveling to Costa Rica for a medical procedure versus having it done in their home country?
Well, I think one of the primary factors behind people coming here is that maybe between 40 and 55% lower cost for what sort of procedures they want. It depends on the procedure, but a lot of people come here because they know that they're going to get a very good service. Most of the doctors and the dentists and the clinical people that we work with have been educated either in Europe or in the United Kingdom or in the States. So they're all bilingual. So there's no issues with language. Very, very professional, very highly trained. There's a huge cost advantage, as I mentioned. And I think one of the things that is very important here is it's relatively safe and secure for people to come here. So there isn't the fear that there's going to be some difficult situations. And the other issue is it being a very popular tourist destination. People often will stay for an extra week or come a week earlier or come with their partner. And then they can have a little bit of a break whilst they're here too and still go home with change in their pocket compared to maybe what they would pay in the United States or in Canada or in Europe. So I think they're some of the primary.
Absolutely. And I think our job is always to reassure people, to have a friendly voice at the end of the line. When we get the inquiry, we try wherever possible to be able to actually speak on the phone. And straight away, when people hear, you're from United Kingdom and you're over here in situ and actually know these doctors really well, the confidence just rises.
Yes.
And the actual directory isn't immense. We work with a very small exclusive network of providers because we don't want people to be confused.
Mhm.
You do have some directories that people just click and pay and no one even goes to visit. But we vet thoroughly the providers that we work with. So it's just to give everybody that it's our reputation and just to gain people's confidence on that side as well. So,
and I think it's very important that we sort of distinguish between agency and directory, because with the agencies, they're going to sort of pick someone up, take them to their doctor, tell them where they need to stay. Whereas with our directory, we let people choose. So they can have a look and assess 2 or 3 different dentists or doctors, and then they can make their own choice for what it is that they wish to do. So we will help them and direct them, but ultimately it's their choice and they can have a tailor-made service to what it is that they require.
Yeah, and if they do want the agency backup, then we do work with medical tourism agents that will collect people and do the whole plan for them, So as David says, a lot of people now are used to searching online for services. So we want to be able to still allow people to do that and to use the information we provide to make their decisions. But we want to be there to support them as well if they want the full agency as well.
That's excellent. It sounds like your company does a really good job of building that trust and that connection with people, especially when it comes to medical services, because, can be a very, very strenuous process. And, you want to make sure that you have all the facts before going into it.
Well, a funny story, Gabby, is we often get people over, and some of the areas, we have a couple of JCI accredited hospitals over here, which means we've the same or even better standards than they have in the US, which is always comforting. And as David says, a lot of our providers have done some specialist training over in outside of Costa Rica as well. But what they always say is, third world country, but best kept secret. When they go to these, shopping malls and fantastic hospitals, they're just like, wow, yes, this, it is a third world country, but there are pockets that, you have all of the facilities and amenities that you have at home. But also they're always amazed that they'll go in and speak with the consultant. Quite often we do Zoom consultations first, so the person can see their surgeon up front and ask their questions and just feel happy about making the journey. But the same surgeons will quite often give people their WhatsApp number after the surgery. If you have any problems, just contact me. And they're like, what? First of all, the doctor spent an hour with me going through everything. And then they said, if you've got any problems, here's my number. And it's like, we don't get that at home.
Very, very, very personalized service. It really, really is. And then Claire does an awful lot to sort of just have the icing on the cake to give that interface wherever it's needed. So it is a more personable service, certainly.
Yeah. It's fun and we enjoy it, and then we get a lot of people coming back again or telling their friends, which is a good sign.
Absolutely.
Excellent. Yes. With that too, what would you say is the most like rewarding aspect of being a part of this industry? I mean, you mentioned about, building those connections with people and having those clients feeling very safe and very satisfied, but what other aspects of it do you find to be very not necessarily like lucrative, but in like the monetary sense, but more so in like the
yeah.
I think
the good feeling factor. Yeah.
What is, I think, very important is, to see people who've maybe suffered. We had a gentleman in his 60s who'd had some issues with his stomach and with tumors in his stomach, and he'd not been able to really get to the bottom of it in his home country. So we helped him find a specialist here. And then we saw him a couple of weeks after he'd had his surgery, came back, and his life had completely changed. And it was just the before and the after was just a most wonderfully gratifying experience to see, and just know we've done our little bit to sort of put them together. I think that for me is one of the most important things.
Yeah, no, definitely. And yeah, just to give people the confidence to make the move and come here, and then support them throughout that process, definitely, and to see literally lives and health changed. And the other side from my point of view is, we're foreigners here in Costa Rica, and we are so proud of the practitioners that we work with, in terms of just the standards, the quality, the professionalism, the patient care, the bedside care. We're just really proud to be able to promote, this little country, but it's doing big things, and yeah.
And I think what's quite interesting, again, another little bit of icing on the cake, is that recently the government has introduced legislation that actually gives an added level of protection to anybody who comes here. If they want to sort of have any follow-up, or if there are any issues, then there is like a now sort of a legal level of protection. So it gives, an added level of guarantee to people who are coming here to do it. So even the government is getting involved and hoping to sort of build the industry even more so with the right sort of legal structure in place too. So works in both ways.
It's incredible. It's also nice to hear how involved the government is too with the practice in terms of providing the financing, and also like providing legislation, especially sometimes, with with the field of medicine, it can get a little bit construed.
Yeah, absolutely.
Yeah.
Yes. So my final question for you two is, what would your best advice be for someone who is looking for treatment in Costa Rica, but they have no idea where to start?
Excellent question. Thank you. Well, come to us. First of all,
use our directory.
Okay, so you can send in a contact form if you're not sure which provider you want to work with. You just send in a general contact form. We will call you back. We will guide you through the options that are available through our resources. We'll always ask for a medical report or imaging where that's available, to get as much information to our surgeons or clinics to review before they then can give you a quotation, a full quotation. And then provided you're good with that, then we can go ahead and have that Zoom call. So basically, it's just making people feel comfortable and confident in their choices. And it's, it's called a directory. But I always joke with our providers and our patients, it's a director with care.
Yeah.
You know, we want to make sure you make the right decision for you. You know, I'll give an example too. You know, we have people who want a certain surgery, and maybe in a lot of other countries, the surgeons would jump at it, you know, because it's more income or whatever.
Yeah.
But we do have cases here where some of our surgeons say, no, it's not recommended to have surgery for, you know,
Yeah.
for that reason. So just the honesty of the people that we work with, we really value their opinions, and people can feel that when they start to deal with us.
We have an actual personal example that I had to have some esophageal surgery at the end of 2019. And I was assessed by the doctors here, and because they'd operated similarly about 30 years ago, they were not willing to take the risk here to actually perform surgery. So they set up for us to go to Florida to find an expert, Dr. Eubanks, an expert in the United States in this particular field of what the issue was. And they did it there, and they helped us with all the insurance claims and absolutely everything. So again, you know, there's no money in that for them, but it shows their level of integrity is very profound.
Yeah, that's one of the hospitals we work with, and yeah, so it was medical tourism in reverse for us, but we got to experience it ourselves. So
Wow.
right.
But most procedures can be done here. Pretty much everything can be covered, but this was a particularly peculiar speciality. So
you're a special case, David.
Special case.
Well, thank you so much for sharing your insight and your knowledge on medical tourism with your company and in Costa Rica. I believe that is all the questions I have for now, but we definitely look forward to hearing your work in the future.
Oh,
Thank you very much indeed.
thank you very much, Gabby, and to your team for the opportunity. Thanks for considering us, and we look forward to welcoming more people.
Yes,
Thank you very
absolutely.
much. Come to Costa Rica.
Yeah, you'd love it.
Thank you.